So this is our last lecture of the day. It's a privilege to introduce Reverend Professor Alasdair Coles, who's an academic neurologist here at Cambridge. He is involved in the treatment of multiple sclerosis, developing treatments for that, managing clinical trials, doing some laboratory work, and is also working clinically in a couple of other hospitals. So he's very involved in the multiple sclerosis work. He's also an ordained priest in the Church of England and is now a minister in secular employment at Addenbrooke's Hospital as one of the chaplains. So his research and his contribution to the life of the church are going very much hand in hand there. And we're going to hear today about the odd bod in the congregation and how we can minister to them.
I have been a neurologist in a congregation and observed the behaviour of some of my fellow congregants for a long time. And for much less time, I've been involved somewhat on the periphery of church leadership and tried to work out how to minister to the odd bod in the congregation. And if that sounds pejorative, that phrase, it's to highlight and get your attention. I hope by the end of it you'll see that I don't actually mean that to be pejorative. I have a slight health warning, which is that I am going to discuss the clinical conditions of epilepsy and of Parkinson's disease, and the statistics are that there will be people who are affected one way or another by those conditions in this room. So I prepare you for that. I'm not going to say anything too gruesome, but just to allow you to gird your loins. So let's kick off. So let's give you an example. So these are all real examples. So this lady, who I'll call Anna, was a member of the congregation of the church in which I was a curate, middle-class professional church in Cambridge. Everyone was very posh. We prided ourselves on the music and the liturgy, da-da-da-da-da. You get the feeling, madam? You've been there? Yeah. And she was very annoying to the congregation because she had, I don't know how she came to this church or why she stayed, but Anna had a learning disability and she couldn't stop talking. And she would often interrupt sermons. She would interrupt sermons by going, "Yes, that's right." And so actually it was very affirmative. So I was never bothered, but people in the congregation found her annoying. And she was often a topic of conversation over coffee and, what are we going to do about Anna? She wasn't well medically. I haven't said, she was about 50, and she died suddenly. And the response was very interesting, because at one level, and I hope you understand this, the annoying thing had gone. But at another level, we felt a huge loss. And the loss that we felt, as I began to reflect on it, was the loss of someone who brought us all down to a very human level. And actually, she had served us well, because us middle-class professional people had been allowed to get down to her level, and we were relaxed. And when she left, even though she had been annoying and we complained about her, we became increasingly uptight as a congregation. So that's a phenomenon that many of you will recognize, but if you don't recognize it, sorry, I'll just leave that. I would commend the work of Jean Vonnier to you, and I like this phrase. So this is one of his reflections on looking after two people with learning disability in his home after he left his first job in the Navy and his second job as a professor in a university. It is an encounter, him with these two people, that liberates new energies that allow us to break the chains of egotism and open ourselves in love to others. And so one of the functions of the odd bod in the congregation, I think, is to allow us to all be odd bods, is to allow us to lose our egotism. Does that resonate with anyone here? I don't know if anyone got any reflections they want to come back at me quickly at. And I'm starting like this because I want to encourage you to have odd bods in your congregation. And then I want to encourage you to see that everyone is an odd bod. And the other quote that I find very helpful when I think about the congregation that I'm in at the time is whether we're a golf club or whether we're a hospital. And you will be familiar with the golf club church. I've been in a golf club church where we're all there because we're interested in one thing. We're all the same. We all wear Pringle sweaters and so on and so forth. But if you stand in the reception of the hospital I work in, or any hospital, all of humanity flows by because you're all there out of a desperate need or a mild need that arise from basic physiology. And I would love to be in a congregation that felt like a field hospital rather than a golf club. So that's all by way of introduction. So here I'm going to spell out the scenario, then ask you to comment. So this is a real case of a vicar in a rural parish many miles from here and many years ago. So he was 50, he was much loved, he'd been in the parish for 20 odd years or so, and no one wanted him to go, if you can believe that. And he developed Parkinson's disease, and actually the congregation rallied round and everything went well to begin with, but his behaviour changed and he started making inappropriate remarks to women members of the congregation, and then very overtly showed an interest in pornography. And this, of course, was upsetting. And he was asked by his bishop to leave, and he retired, and he hasn't worked since. So let's imagine that you're his assistant curate, or you're his bishop. What sort of reflections might you have on this scenario? How much of this was him? How much was his disease? Did people recognize a difference? And very sadly, the possibility that this might have been a neurological phenomenon did not occur to anyone. And what I can tell you, what none of you knew, but why should you, is that one of the drugs to treat Parkinson's disease has the potential side effect of provoking in men an interest in pornography and in women an interest in shopping. It's true. It's true. You can look it up. You can look it up, and it can become excessive in both domains. And when I got involved, I stopped the drug, and all this behaviour disappeared. But unfortunately, he couldn't return to his work because no one really accepted that this was a drug side effect. There was a lot of discussion, different dioceses, different bishops, saying, well, surely this reveals something deeply inherent in him that was flawed and it will come out again. And that made me very sad. It made me very sad. And it made me reflect, well, how could that have been prevented? So I have a top tip for you. So you may not be aware, but if you've ministered in the United States, in larger churches, it's very common to have a medical committee as part of the church. Has anyone encountered this? Thank you, at the back. Yeah. So again, I've been involved in this briefly, where doctors and nurses and other healthcare professionals, amounting to 3 or 4 people, that's what we're talking about, will work with the minister when odd medical things happen and can provide a little bit of input. And it's such a shame, because I think if there'd just been that attention to the possibility that this might have been a drug side effect or a neurological phenomenon, then that would have defused this really early on. So I think it's one of the things that I would encourage you to think about. And I'm going to make an advert for something called parish nursing later on, which sort of forms part of that. Madam, the quick response. You've got a parish nurse. Terrific. I'll call you in a second. Prepare yourself. Yeah. And it would be my reflection that the churches that I've worked in haven't been very good at being aware of the medical, physical side of the people's troubles in their congregation. And you might well say, as one minister said to me, well, that's nothing to do with us. That's the job of the GP and so on. But the trouble is, it is to do with us. It is there. There'll be people here who are well aware of the difficulties of clergy folk with more sort of ordinary mental health problems, if I can put it like that, depression and anxiety and so on. Thank you. Yeah. Let me ask you what you do in this situation, then I'll tell you what I did. So this is a woman who was described to me as completely bonkers by her husband after I just conducted a lovely pastoral, rural wedding. 2 beautiful young people, off they were going. Everything was perfect until this woman rushed out at the end and asked if she could have communion. And her husband held her back and said, "Don't do it, vicar, she's bonkers." And the reason that she wanted communion was because she was plagued by devils, and that only Christ's body and blood would heal her. So this wasn't a member of the usual congregation. I'd not met her before, and she was a relative of the family getting married, and almost certainly I wouldn't see her again. I have to say that this is one of these things which I was never prepared for. I missed that week in vicar training. But I guess something like this has happened to you, out of the blue, completely bonkers, and you what do you do? So I know there's some experienced pastors here because I know some of you. How would you respond in this sort of situation? Yeah. So, I mean, if I can just repeat you, because I completely agree. So you would be disinclined to give her communion because this is so out of the blue. You've no idea of the context. You're not part of her support team. You don't know how this would be understood. Everyone comfortable with that? Is there anyone who would give her communion? I'll come clean and say I did give her communion. And to this day, I don't know whether that was the right thing. And actually, it's just the point you've raised that has most concerned me, which is that I might have been reinforcing beliefs which were not good for her health. But I was under the sort of why not category. I was thinking, that, there's no law that says I shouldn't give communion to people who are odd. There's no law that says I need to know every last detail about them to give communion. So I felt that was sort of okay. But I have to admit, I also felt very pressured, and that this was the easiest way to get out of this situation. And I wonder if I shouldn't have backed off a bit and taken her into the vestry and so on. So I agree completely. So, under the sort of why not category might be the sort of why not be part of the solution here and provide spiritual comfort. I mean, the one thing I did do, which I think was the right thing to do, was phone her minister and say, "I'm really sorry. I don't know what I've done." But and of course, what response I got was, "Oh, that'll be Mary. Don't worry. This happens all the time." I mean, you know that, because this person will have been plaguing, if I can be pejorative, their minister. So. And I felt a lot better as a result. And actually, his view was that if I'd given her communion or not given her communion, it would have made no obvious difference either way. But it would have been a big scene if I hadn't. So. Yeah, thank you. And that's challenging me, as you were challenging me, about the distinction I've made implicitly between mental health and physical health. And I suppose we all do that. And the reason we do that is, or the reason I do that, is because you want to feel that this person receiving the sacraments is buying into it rationally at the same level that you are, that they are, that we're talking the same narrative. And you know, I feel out of kilter if someone is talking about taking communion to get rid of the demons. And I get it. And what you haven't asked me is what happened. She calmed down. She calmed down, and she went to the reception, and her husband thanked me, even though he told me not to do this. Thank you. At Vicar School, someone told me that the word liturgy means work, and I don't know if that's true or not. But it can do work for you that you can't do yourself, can it? Yeah. So I'm not offering a clear answer here because I'm very sympathetic with your view, sir. And I feel very uncomfortable at these kind of one-off episodes. And they've become much more acute for me working very part-time in the hospital in a chaplaincy role, and many people here will have done that. But in the middle of the night, you can get called to the most bizarre situations. And never, yes, we've all had, and it's, you feel completely floored as to what to do, often, or I do anyway. Okay, let's move on. So this is this is more where I wanted to go, really. So this is a person who, when I first met her, was age 40, and she was living in a religious community, Christian religious community. And she was brought to see me as a doctor, I was a doctor, by a member of the community who said that she was unwell, although she herself said she was not unwell. And what she described, which the community thought was a problem, but which she did not, was these attacks, where she would suddenly feel at peace, she would be content. She described this movement from darkness to light, lasted seconds or minutes, and she'd had them for as long as she could remember, once or twice a week. And to begin with, as a child, she hadn't understood their significance, but as in her teens, she understood them to be a gift from God. And it was particularly because if anything unpleasant happened to her in the playground, and she remembered a particular incident when someone hit her, she might have one of these a little while later, and it would make her better. She'd become interested in religion, and academically and personally, and had taken life vows, and actually was working as an academic. And if this identifies her, it's not a problem because he's allowed me to tell her story. She works in the Catholic community as part of the team that validate miracles on behalf of the church. And she still does that. On one occasion, she's had a bad trip, as it were, where she's gone to hell, just for a few seconds. And that's that. So you're not a neurologist, but you're a minister. So someone comes and tells you this. What's your response?
Sounds like a saint to me.
Sounds like a saint. It is.
Teresa
Absolutely. Absolutely. Teresa of Avila is absolutely the person that comes to my mind as well. And for reasons which we'll come back to, yes. So that's what you're going to declare her a saint and advertise your parish. Milk it for what it's worth. Get the church tower repaired. Yeah, excellent. Church of England at its best. Can I just pause you a second just to allow people to catch up? So you've made the correct diagnosis, which is epilepsy. I'll bring you in just a second. But for those of you who need to catch up, epilepsy is a disorder where a part of the brain fires inappropriately, and often that will spread to the whole of the brain, and so people fall to the floor and convulse, and you've all seen that, at least on the television. But it is possible to have smaller versions of that where just one part of the brain is triggered, and so you get symptoms attributable to the normal function of that part of the brain. So you might get shaking of the arm or whatever. So this is temporal lobe epilepsy, and just to bring you up, the person who had this and described it the best was Dostoevsky, and they're called Dostoevsky seizures, and they're actually described in the character of Prince Mishkin in The Idiot. And it's a fantastically provocative book, this, because Prince Mishkin is a Christ figure who's morally perfect, who has these illuminating seizures. So I'm going to come back to you in a second, madam, because I'm going to pick you up. So you've made the right diagnosis. She does have epilepsy, and we went on to prove that. So I then said, being a neurologist, well, we can get rid of these for you. I can give you tablets. So thank you. So let me just press you on that. So what you're saying, if I've understood you, is that religious experience happens, that the brain will be involved in it, just like it's involved in language and so on, but me finding out that the brain is involved doesn't diminish it. Okay, so I'm getting some very positive signals. Anyone to say?
Is it damaging her brain?
Is it damaging her brain? So there is a downside, isn't there, to epilepsy, and so for those who are unfamiliar with this, it is possible that she'll go on and have a convulsion. And so part of my thinking, and she certainly can't drive if this is happening. So part of my thinking is we need to protect her from this possibility, put her on drugs, then she'll be able to drive, won't have a seizure, I'll feel better. But to this day, she's resisted that, although she has complied with not driving. So let me stress you all a bit. So since I wrote about this person in the neurological literature, I've been getting referrals from the country, and I have a monthly clinic where I see people who tell me very strange things. And I have to try and work out whether they have epilepsy or schizophrenia or something else, or whether this is God. Or at least that's often the question that comes. And I've already framed this in a way that would upset my friend there, because I've made a distinction between a disease and authentic religious experience. And I think that actually distinction is out there. So, in other words, people like me have to be careful that we don't invalidate things because we can give them a physical explanation. Because out there is dualism, live and well, so that if you can say the brain has done this, it means you haven't had an authentic thing. So leaving that to one side, I have been forced into the position of being how you might be put one day, with someone coming along to you with this sort of thing and saying, is it really from God or not? How do I tell? How do I tell whether this is from God? This is now the person themselves. So what you've done in a few minutes has taken me 10 years. So, so to begin with, I used to obsess. All these people, they'd come and tell me this, and I said, did the devil have horns or not horns? Did he do this? And actually, I'm just catching up with a lot of you. I've come to the view that you just can't tell from the nature of an experience whether it's from God or not. You can have a completely bonkers experience that clearly is from God by the metric I'm about to discuss with you. So, so the person who has written about this the best and also the first is William James, who is the father of psychology as a scientific discipline and was very interested in religious experience. And to him was put the question, is this from God or not? Quite a lot. In the history of Christian mysticism, the problem how to discriminate between such messages, and he was actually talking about people like Teresa, and experiences as were really divine miracles, and such others as the demon in his malice was able to counterfeit, thus making the religious person twofold more the child of hell than he was before, has always been a difficult one to solve. And we're agreed on that. Needing all the sagacity and experience and the best directors of conscience in the Church of England in the Diocese of Ely. In the end, it had to come to our empiricist criterion. By their fruits ye shall know them. And so it's taken me a long time, but I've caught up with you, madam. So my questions now are nothing to do with the experience. It's what has been the impact? So what was the impact? So that's the quotation. The quotation actually is about false prophets, of course. It wasn't about discriminating illnesses. So in the case of the lady who I've described, her life had become chaotic. She had multiple visitors to her room late at night of both genders, neither, not related to the community, and this was breaching all sorts of rules. And her behaviour was becoming very eccentric. She did get arrested. She ended up in prison after something that no one can quite pin their foot down. And she started straying from the orthodox path of her religion. And she was asked to leave. She then ended up in a squat, and by any kind of Western materialist judgment, her life had gone downhill big time. And by an orthodox judgment of her faith life, that had deteriorated as well. However, she refused to take any treatment. She felt this was all part of God's plan, and is still moved, and is working as an academic in the university in a theology department, and more or less holding it together in another place. And we have this debate. To this day I'm having this debate, and I find it very hard in her case to validate her sense that this is from God, and I haven't done that. You may say it's not my job to do that, but it's sort of become my role in some people's lives. So, do you find yourself as a minister being faced with people with odd experiences and having to work out what to do with them? Is that a situation you find yourself in? Yeah. And how do you respond? What would be your metric? Or do you avoid the question? So how common are spiritual experiences? So there's the Alasdair Hardy question. Alasdair Hardy was a orthodox, good zoologist, FRS, who in his later years had an interest in religious experience. And he came up with this question, have you ever had an experience or the feeling that you're in contact with something other, something outside of this world? And that question has been asked repeatedly since the 1960s. And the proportion of people who answer it is going up every year. Every year. So in the UK, when this question was last asked, which was 2004, to my knowledge, 60% of an unselected population has said they've had one or two events like that in their life. So the majority of us have had these numinous contacts. When I read that, I thought, that's amazing, because no one's ever told me about their weird experience. So I'm reinforcing what you're saying. But also I think what a fantastic evangelistic opportunity, because we only have to talk about this, and 60% of the people, have had the same sort of thing. This experience of ecstasy or in contact with the universal, feeling there's something other, non-materialist, non-reductionist. Yeah. So you might be interested, I'll move on from this topic in a second, but I'll just leave it with this. So my prejudice is that these experiences are very core and very universal, and that in the content of them there is no difference between God-induced mysticism and epileptic-induced mysticism. That's my prejudice. And so we're doing a study at the moment of people who have these attacks very frequently. And the theological question is, if you experience God many times a day, as opposed to 2 or 3 times in your lifetime, what is the consequence of that in terms of your thinking about God and your behavior? Do you become someone who's very interested in religion? Do you become someone who wants to read sacred texts all the day? Do you become a morally better person by whatever metric? And the provisional answer seems to be no. Actually, you just become more and more chaotic in all of those domains, and your theology loses its structure, loses its orthodoxy, and by any kind of outside metric, things are not going well. And I guess when I read the New Testament occasionally, you get a picture there, I think, that describes a mature faith as being rather suspicious of experience and wanting to take it in context, particularly discussing with other people, testing it against Scripture, and balancing it with personal and communal worship, and so on and so forth. You know the story as well as I do. In other words, I turn to my faith and I find actually it has a rather more mature reflection on this than I do. And that's been a resource for me. And now I'm going to move on to another problem, another issue. So this is a real life case, but I bet you know this person or someone like it. So he's 40 years old. He comes to church in a wheelchair, and he's seen around the village in a wheelchair, except that other people have seen him walking normally. He has fits, often in public and often during services. They cause complete chaos. When he's not having fits, he complains that no one visits him, although actually when you add it up, a lot of people visit him. And he's often angry, and he complains that the church is not well adapted for those with a disability. So does people recognise this?
Yeah.
You met my friend? Or something like it. So perhaps someone who hasn't yet spoken, I mean, what would be your reflection on this in the life of a congregation, this type of odd bod? So from a professional point of view, this is either malingering or this is a functional syndrome, which is the posh word for saying there is no physical cause for these symptoms. And I know of 2 churches in Cambridge who have people in them who are said to have MS, very disabled from their MS. It's a big part of the church kind of structure looking after them, and they don't have MS. You know, they don't have anything physical wrong with them. So now I've told you that, does that change your attitude? So do you agree with me, and I have seen this happen, that this person can destroy a congregation? Has anyone seen that happen? Yeah. And I've seen it because this person or someone like them becomes the focus of the inadequacy of everyone to provide the Christian loving care that we're all called to do. You know? How do we cope with that? Yeah, so kind of looking outside of the church at resources elsewhere, yeah. Because I think one of the dangers here is that, and people have already got this, but just to articulate it, is that a church congregation feels it should be competent to deal with anything that comes. Thank you. And that was what really made a difference in this case, was when we all said, you know, we're just not coping, we're all, you know, whatever we do, Graham, or whatever he's called, you know, just hits back at us. Nothing we've tried has helped. And so we kind of gathered together a little team of people who were not the lovely, sympathetic, prayerful people who were caught up in this thing, but some hardline folk, the local GP, the parish nurse, which is your entree, to say, okay, let's draw up a contract. You know, we will provide a couple of hours each week, and that's it. That is all we can do. You know, that is it. And I don't know whether it helped him or not, but it sure helped the congregation. You know, that we got together and said, this is what we can do, and we can do no more. And it was a very painful business, and a lot of people felt we'd let him down, but it was the beginning of coping. The parish nurse was really important there. What's a parish nurse? So if you don't know about parish nursing, can I really encourage you to look into this? And my theological encouragement is that you are failing the Great Commission if you don't. That our inheritance is churches and congregations which took physical health really seriously. Our hospitals were built by churches to begin with. St Andrew's, Chesterton, where I was a curate, had the equivalent of a GP practice next to it, paid for by the church in the 12th century. That is our inheritance. If you go to West Africa, that lives on. So a third of the healthcare in Nigeria, where I was briefly, was provided by the Anglican Church. And we've kind of lost that. And I think what we've lost on the way is sometimes kind of mature patterns of behavior when it comes to this situation. And so just as I talked about medical committees, which is a rather US thing, I think we could benefit by having parish nurses as part of our ministry team. It's a sign that we take healthcare seriously, but it also brings all those professional skills that nurses have, which is largely, in this context, about knowing the lie of the land locally. So it may well be that your parish nurse says, well, I know that the local psychiatry hospital has a drop-in every Tuesday. I know that they should be seeing their CPN, and so on and so on and so on. All those contacts that you, as a non-medical minister, might not have. So parish nursing, great website, please look into it. Okay, last case. So this is someone you're going to be looking after if you haven't already looked after. She's 70 years old. She's been in your church for 40 years. She's done everything. Run the junior church, the creche, coffee rota, the summer fete, the Sizeman's rota. There isn't anything she has not done and been loyal and faithful to. She develops Parkinson's disease. Everything's fine, and then she starts not turning up. She doesn't come to the summer fete for the first time in 40 years. And then she stops coming to services. And when people ask her, she just seems uninterested in taking part in things. I'm so sorry. Is she shopping? You're going to remember that, aren't you, you see? I've got this worm in your brain, you see. I've made an impact on someone. So she's not shopping. She's not on Ropinirole, which is the drug that causes that. Anyone got any reflections? So you're the minister. People are worried. You know, what do you do? What could be going on?
Is it a side effect of the disease that mentally it does something to that part of the brain that affects faith?
So that's the question, isn't it?
That's the question.
It is the question. Yeah, and that's really the conundrum. And so it is undoubtedly the case that people with Parkinson's disease, as time evolves, attend their place of worship less frequently and express an interest in attending or taking part in church life less frequently. That data is all from the United States. And if you get a brochure from the Parkinson's Society of the United States, whatever it's called, when you're newly diagnosed with Parkinson's, it will say in that this disease may affect your faith. And this is something that we began to look at because there are alternatives, and you've mentioned two of them. So one is just the simple mobility thing. You're not going to church because you can't get there, to put it crudely. Another is that there might be more, as it were, generic issues with Parkinson's, like memory or loss of motivation, that might reduce someone's appetite to attend church or synagogue, but not undermine their faith as such. So those were the questions that we sought to answer, and I'm going to actually skip a lot of this. I'll just briefly outline it. So one of the things that we felt the Americans have done badly, and they've done a lot badly, is that they'd use normal healthy controls. And so all of the people we had as controls for this study had some impairment of mobility. So they had rheumatoid arthritis or back pain or whatever. And we followed these two cohorts for a year, and we asked ourselves the question, over a year of Parkinson's disease, how does their religious life change compared to people who have similar problems with mobility? And would you believe it, there are scales that you can use to measure all this stuff. And actually I'm going to flick through this because I want to get to the... So this is people with Parkinson's disease at time 0 and after a year, and their mobility goes down. They have a progressive problem with mobility, whereas the controls didn't have a progressive problem. Their mobility stayed the same. People with Parkinson's had a reduction in their memory over a year, whereas people with rheumatoid arthritis didn't, and so on. However, at all scores of spirituality, other than attending churches, people with Parkinson's were flat. There was no change. Bizarrely, the controls had a reduction in their expression of spirituality. And we did some interviews, and I should have said from the beginning, these are people who were randomly selected. They weren't selected from church congregations. They were selected from Parkinson's clinics, so they didn't necessarily have a faith at all. 3 out of the 42 patients with Parkinson's felt they'd been abandoned by God. All of the others had something positive to say about their spiritual life. All of them. So this person who was agnostic said that having Parkinson's has made me more interested in faith because sooner or later it's going to get worse and I need the support. This is a Buddhist who said that meditating was much more difficult now because she was shaking, but she wanted to persist with the practice. But many people came up with these positive affirmations of what life with Parkinson's was like in terms of their faith. It's an anchor. It helps me through difficult times. It's a good feeling, I think, to have a belief. I'm always conscious that there is somebody there to whom I can raise my problems with. Yes, it would be very much a loss without that. And yet all of these people had a reduction in their visits to their church or mosque or synagogue. And we've written a leaflet for the Parkinson's Society of the UK, which says, if you get Parkinson's disease and you have a faith, your fundamental faith will not be challenged, at least on the evidence we've got here. But it may be more difficult to practice your faith, and you might need to make accommodations to that. And I think that's a lot more positive message, and I think it's better science than what we had before. So it reminds me, when I'm acting as a minister in a congregation, that there's more to life than people turning up and coming to listen to my sermons. I mean, obviously, most of the time that is the critical thing. But it is possible to have a religious life and not hear me on a Sunday, strange as though that seemed. And that is an important rebuke for us, I think. In terms of how we think about the religious life of our congregation. And also a challenge to how do we support and affirm someone who isn't coming to our church and yet feels that their faith lives on and is supporting them. What do we do about that? What are the challenges around that? I mean, there is a real problem here because most doctors will not regard you as a professional. And will not feel that the confidentiality boundaries would accept you in them. And you may want to argue with that, but I think that would be the professional position, that you're just not in the circle of trust. Now, I wish it were not the case. But for instance, the chaplains in hospital, strictly speaking, shouldn't be looking at hospital notes because chaplains are not regarded as healthcare professionals, sadly. It can work. I think here, if you don't mind me dropping the name in again, parish nurses can be very powerful because they can have relationships with GPs that you as a minister can't, because they have the badge. They're in the circle of trust. And where I've seen parish nursing working really well, it's where they just are able to drop into the GP and say exactly what you want to say and get the feedback.